Here I am at Yavapai Regional Medical Center in Prescott, Arizona, and I said it right. I didn't say Prescott, I said Prescott, Arizona. And I'm working with a group called the Pets Are Wonderful Support. It's a pet therapy group that comes into the medical center and works with patients to make the patients feel a whole lot better. Now, a lot of people are aware of pet therapy nowadays, but years ago, there was no such thing called pet therapy. It was pets for the disabled, pets for the handicapped, all those politically incorrect terms. And we were talking before this all started, the only dog that was allowed into public places were seeing eye dogs. Hearing ear dogs were not allowed in public places, or any dogs for any type of disability were not allowed. Oh, that's okay, let them growl. In other places, that's fine. But the bottom line is this. Years ago, I was working at a place in Green Chimneys, and I was training the first hearing ear dogs in the United States. And I knew we had to get publicity. And there was just no way that anyone wanted to hear. The politicians didn't want to hear about these dogs. So I took a group of 9 people, 9 PhDs that I trained from all over the country, 9 dogs, and we went into Bergdorf Goodman on 5th Avenue in New York City. We walked in, we immediately got stopped by security, they called the police, I went to jail, but it got out there, the term got out there, pet facilitated therapy, and a year later, hearing ear dogs were recognized to be able to go into public buildings as well. Sometimes that's what it takes. But that's what I did. But that's very little. You know what I really have gratitude to? I have gratitude for the amazing people all over this country and pretty much around the world right now that volunteer their time and their efforts to go into nursing homes and hospitals and hospices and even penitentiaries just to make people feel better physically and psychologically. You know, we talk about the effects of pet facilitated therapy, and all of you here know that it alleviates stress, reduces blood pressure. Also, senior citizens that take medication can drop their medication almost 50% if they have pet facilitated therapy or some access to it. So there's some amazing things that are taking place, not just physically, but psychologically. You know, we all know, I know this is a term that we use a lot, holistic. I'm a big fan of holistic. Holistic means every part of you, inside, outside, spiritually. And I'm also a firm believer that lifting someone spiritually by having them play with a dog or a cat is really going to help them feel a lot better and get better a lot quicker at the same time. A couple of thoughts I want to share with you. So what are these dogs used for nowadays? You know, we all know about the seeing eye dogs and the hearing ear dogs. What about dogs that are used now for mental stability? There's a lot of people that have severe anxiety. These dogs are now working with these people in terms of keeping it under control. The first dog that was ever trained for seizure detection in the country was trained by me in Boston, Massachusetts in 1975. The woman had epilepsy, and what happened was, when she had a seizure, they would take her to the hospital thinking that she was a drunk or a junkie. And I remember training the first seizure dog, and it was half golden retriever, Gary. And what we taught this dog was to pick up on that scent. There was no training I can do, but just the woman changed prior to having a seizure. Her chemistry changed. By the way, the same reason, I just did a story on this. People ask me, how does my dog know, or how do dogs know when someone's going to die? And it's very simple. The body chemistry changes just prior to death, and the dogs pick up on that change. I also believe that they see, for those of us that have a soul, I believe they see the soul moving on to the afterlife anyway. But there are so many new things. I mean, I remember children at hospitals. I've gone into hospitals. I remember working with the Ronald McDonald Group and Kathy Lee Gifford in New York City, going into one of the houses she was supporting and bringing pets in there. And just to see the smiles on the children's face was absolutely worth it. So my thanks, you know, a lot of people say, Warren, thank you. No, it's not me, it's the people that are in the hospitals every day, the people that are working with these therapy groups. And what we're going to do is we have a great group here. I'm going to tell Portia to cut the camera, and that's what we're going to do. And I'm going to talk to each one of you individually, and I want to find out exactly what you guys are getting out of it, what your dogs are getting out of it. And one of the questions I always have is the dog happier when he comes into the hospital, or is he happier when he leaves the hospital? I want to find out the answer to that. Not so much about your concerns, but I want to find out your dogs' concerns. So we'll be right back talking to these amazing people at Yavapai Regional Medical Center. Pets Are Warm Support. What a great name, because that's exactly what they are. And we're here with the Pets Are Warm Support Group at the Yavapai Regional Medical Center. And why don't you tell everyone your name, because I heard you were really instrumental here in putting this whole thing together.
I'm Linnell Walters. I direct the Volunteer Services Program here at the hospital. And I'm an animal lover, and I had been reading and hearing the stories about animals in acute care environment and what they can do to help patients. And that's why I got involved. I wanted to explore that, and as it happened, Gary DiGeronimo at that same time approached me about starting a program here, and it was one of those serendipitous, perfect timing things. So together we got the program through our board and with our administrative support and got it started.
Now, did you meet much resistance at first?
It was not so much resistance as education. It was teaching them what the program would involve, what kind of screening we would do for the animals, so we could assure them what as much as we could, that we would have bomb-proof animals coming in here. So we would have some predictability of what to expect if a fire alarm went off or something like that, and educating them about the infection control concerns and things like that. Once we gave them those assurances and educated them a little bit, they were right on board with it.
I just want to ask you, has it exceeded their expectations and yours as well?
Absolutely. It's the single program that we have started that gets the most positive feedback. And I report that to them, and we've been doing it long enough now, they know that. They hear those stories.
And the response from the patients, do you get letters back from them? When you have patients say, I'm just going to get sick so I can go back and be one of the
Absolutely. They often will call and say they want to support the program, they'll make donations, or they want to come and do it themselves with their own animals because it's had such an impact while they've been a patient.
I can't imagine anything more positive than the relationship between a dog and someone who's just not feeling themselves. I mean, no matter how bad you're feeling, I was going to say that lick across the face, but they're not allowed to do that in the hospital.
Right.
But it really does make you feel whole. Or just seeing them, there's something about them. They know you're not feeling well, and they behave differently. Like my dogs, when I take them around someone who's not feeling well, they know,
yes.
And they react differently. And even with me, they react differently.
Absolutely, they do. They adapt. You can watch them adapt to the needs of the patient. They're so intuitive.
Dogs are so honest. They never borrow $10 and don't be paid.
So far.
So far. I got a couple dogs that owe me some money. And your name?
My name is Carol Maslansky.
Now, Carol, how did you get involved with this program, and how long have you been involved with it?
I had my first therapy dog I had in 1993. And
so you were a pioneer too.
I guess.
Yeah.
I didn't consider myself that, but and we did therapy work back in Westchester County, New York, until we moved here in 1996. And then there was a...
By the way, I started the program at the Westchester Medical Center.
Good for you.
There you go.
Wonderful. Great. And hopefully White Plains.
Not White. I haven't started White Plains. I saw someone else started White Plains now. I was smart enough. I left the East Coast, okay? Oh, no. This is going on the website. I love the East Coast.
And then when we moved here, there was a hiatus until the program started here. And when I heard about the program starting, I basically said, me too. And so we started.
So you got several dogs already in the program?
Yes, I have a dog named Taylor. She's my fourth therapy dog.
And what type of dog is Taylor?
Australian Shepherd.
Oh,
all my therapy dogs have been Australian Shepherds.
oh, Aussies.
And I have another dog, Winnie, who's 2.5, and she will be evaluated the next time around. So.
Okay, so you get up in the morning, and I know everyone has a scheduled day that they come in, and how many patients would you normally see in a day?
It really depends. Normally we do some of the waiting rooms. We don't do IV therapy, but we do cardiac rehab. We do then one floor. So in the waiting rooms we see predominantly, patient families.
So you might see anywhere from 5 to 20 people in a day.
Oh no, much more than that.
More than that, really?
Oh
wow.
yeah.
Wow.
On the floors we'll probably see anywhere from 15 to 30 patients.
So here's a question for you. Now you take the dog, and I'm going to ask the same question to everyone. You take the dog, you bring him in. We talked about this earlier. The dog, as soon as you put on that shirt, that dog knows you're going to work, and so the dog comes here, does his job, you do your job. At the end of your day, how does it make you feel? That's question number one. And question number two is people don't realize that these dogs, even though they enjoy what they're doing, they're working Do you ever find that at the end of the sessions, or the end of the day, the dog looks up and says, "Hey Mom, let's go home, have dinner, I want to go to sleep, I'm tuckered out"?
I always try to watch my dog and make sure that we stop before that.
So try to do something to stimulate him mentally,
Well,
or just cut it?
just stop. And there are visits that can be extremely draining for me as well as the dog. And oftentimes we will try to have a more positive experience, maybe with staff or something, and then end the visit. When there's a very an emotional patient, a patient that's in a lot of pain, a patient that is just drawing a lot out of the dog and me, many times, you know, I just feel that's enough for my dog.
Enough, that's it, time
That's
to go
it.
home. And I always tell people that with
Yeah,
any type
yeah.
of, with any
And
type
even
of
if it's
work.
the first or second patient we
Yeah,
see,
yeah.
if that's where we have to stop, that's where we stop.
I tell people that no matter what you're doing, if you're training a dog or working with a dog and the dog is getting bored or you're getting frustrated, stop, have a glass of Chardonnay.
Yeah.
It's just the way.
What I usually try to do is find a staff member, you know, who will give the dog a positive experience.
Well, let me give you, on a different note, after 9/11, I was called in to find the needs of the New York City Police Canine Unit with my background. So I went to New York and I was the first press. It hit me hard, this is my hometown, New York City.
Sure, yeah.
But watching these dogs work, and the problem we had with the dogs in New York City is these were search and rescue dogs, they were not cadaver dogs. So they were used to finding someone that was alive and reacting to that living person.
Yeah.
And the dogs were becoming so depressed because they weren't finding any survivors, that some of the volunteers and the search and rescue workers literally had to bury themselves under rubbish so the dogs would find someone that would pop out that would be alive to make the dogs feel good about them. So basically it's the
Yeah,
same thing.
You do whatever you have
Yeah,
to do.
yeah. Let me move down the line. Your name?
I'm Esther Houston.
And Esther, I met your dog, and I'm just coming over here and say hello to your dog because he's such a sweetie. Hi, sweetie.
Rosie will set up in a chair for
This
you
is
if
Rosie.
you'd
Oh,
like.
here, Rosie. Have a chair, Rosie. What can I get you to drink? Come on up, Rosie. There you go.
This is Rosie.
So tell me a little bit about Rosie.
Rosie's now 12 years old,
God, she looks like a baby.
and she started in agility with Carol and Kathy when she was just a baby and finished all her agility titles. And then the pause program started, and this is a no-no. No
Listen, it could be no for you, but you wish me one more time, I'm proposing where I did.
I have had patients say, "You look the other way, I need that." But we don't encourage it at the hospital. I retired after 50 years of nursing,
I see you're very familiar about working with people with
Yes.
different challenges.
and this was just a natural for me when the program started. I heard about it, and I passed the word around the neighborhood to all my Aussie friends that knew much more about Aussies than I did. And we all
So this
got
is your
started.
clique here, huh?
This is our clique. We're all neighbors, except Barkley.
Except for us.
Except Barkley.
But we let you.
But Rosie thoroughly enjoys this job. I do have a 3-year-old now that the neighbors said it was time to get a 3-year-old so Rosie could teach her.
That's right, the best trainer for a dog is another dog.
And she does come to the hospital. I bring Rosie every Thursday morning. I bring Kate every Friday afternoon. Rosie knows everybody in this hospital by name.
I saw you walk in the lobby and it was like, not one person, I don't want to say this, but not one person said hello to you. They all went down and said hello.
Certainly, they don't know me. They know Rosie.
And how does it make you feel? As a nurse, I'm sure, you know, over the years you've helped so many people, so you have that feeling when you go home of accomplishment. But when you take Rosie, do you get that same feeling
Yes.
of accomplishment that you had when you were nursing?
Yes.
Rather than doing the
Yes,
physical
it
work?
has been very good for me, as well as good for the dog, as well as good for the patients, as well as the staff.
So it's an all-win situation.
It's a win-win-win
A
situation.
win-win-win for Rosie. That's what it's all about. All right, let me go talk to some more dogs.
Okay.
Thank you, Rosie. Rosie, I know you're not allowed. See
Would you like to see what else Rosie does?
Sure,
you
what
got
did
it.
you do? Yeah.
You have to
Rosie,
see this.
sit. Sit. Thank you. We don't keep the Kleenex.
Was she there for anybody?
Yeah,
Really?
yeah, if you can treat.
Oh, see now.
No, she will.
Achoo! Achoo! Thank you.
We don't keep the Kleenex within reach
I,
at home.
thank you. My nose was running. Thank you. But, you know, it's fascinating, but what I'm also finding out, and you're next on my hit list here, what I'm also finding out is that things like that, like teaching a trick. I write about in my books the concept of teaching the dog tricks. I don't teach tricks for tricks. I could care less whatever trick my dogs do. You know, it'd be easy for me to teach my dog to go to the refrigerator and get me a beer, but I would not do that. I find what really interests them. And I find that by teaching them a trick, it keeps them mentally stimulated. But I gotta find that, for example, if you were to come into my backyard in Santa Monica, California, not so much in Sedona because it's all lots, but in Santa Monica, it looks like the US Open was just played there, okay? Plus I have a kiddie pool. It's the Flintstones because that's what my two dogs decided they wanted. And people ask me about dogs that dig holes. As a behaviorist, as a trainer, I cannot stop the dog from digging holes. That's instinct. But I can teach a dog where to dig and where not to dig. So what I did is I filled up a kiddie pool with sand. I buried their toys in there. I went out into the kiddie pool and I dug and I teased the heck out of it. Because one of the things, if your dog doesn't want something, just make believe he can't have it, okay? And I teased them. I did it at night so my neighbors didn't see me. And now that's where my dogs go to dig. That's their little sandbox. And I actually advocate this on the radio show. And a lot of people do the same exact thing. They have their dogs where they can dig in a specific area. But teaching them tricks is a great idea. Great idea.
I learned this from my friends.
Oh, so you're the tricksters over there too. We'll get to you. We'll get to you. So tell me a little bit about this guy. This is a boxer.
Yes, it is.
And I am a big fan of boxers. I love anything that looks like it chases a parked car. and so when I was growing up as a kid in the Bronx, boxers were very popular. Boxers and Cocker Spaniels were popular, and Fox Terriers.
We had a
Now,
boxer when I was growing up.
So there you go. Great dogs. Now, Barkley, right?
Yes.
Barkley's
He's an older gentleman.
chronologically challenged.
Yes.
Okay.
Yes.
And he's been doing this for, he's 12 years old.
He's 11.
11, sorry. And Barkley's been doing this for how long?
He's been coming for 7.5 years. He came from Boxer Rescue in northern Illinois.
Really?
When he was 4 months old, and we lived back there. Then we moved out here, and all my dogs have been obedience trained, so just because I like to do that.
So let me ask you this question. You do the obedience training, you decide to get into therapy, to work with your dogs and helping people, and you decide to use a boxer, and, you know, 11-year-old boxer is an older boxer.
You're not kidding.
And my question to you is, do you believe that the therapy work that Barkley does and the fact that he's involved and has a purpose, just like people that have a purpose, do you think that's added not only to the quantity of years that he has, but also the quality of life that he has?
He loves to come here. He knows when it's Monday morning.
Well, that's his day, Monday
Yeah,
mornings.
Monday morning is his day. And I now have a second dog in the program, and they vie for my attention on Monday
Really?
mornings. And they both go to the garage door to wait to see which one I
So who wins?
I think one week and one
So you alternate.
Yes,
You alternate,
yes.
great. And how do people react to Barkley? Do you find a lot of people, obviously it's a hospital, you can have a lot of seniors here. Do you find that they relate to certain dogs because it was a dog they had when they were younger?
A lot of people say that they had boxers when they were young. Some people think he's a pit bull.
Which, by the way, make amazingly
Yes.
great
Oh, I'm not
therapy
arguing.
dogs.
I'm not arguing. And the dog that I have at home, the female, is black, so people are a little bit
Exactly.
more frightened of her. You couldn't be frightened of this guy. He just is very sweet and always has been.
I don't know what it is with people and black dogs. We just did a big segment with Verde Valley Greyhound Rescue. I'm a big Greyhound fan. I remember bringing 40 Greyhounds on the Today Show with me at one time. Not long, I had to walk up the stage, he was so afraid. But one of the women we worked with, and it had I think she had, I don't know, maybe 8 or 9 or maybe even more black Greyhounds, because they can't find homes for the black Greyhounds. They can find homes for the other color, but people just don't want the black dogs. And Gary and I have talked about this at the shelters. Even the black dogs are the most difficult to find a home
Yes.
for. In fact, I just did some work with one of my stations in Detroit, Michigan, where they had an Adopt a Black Dog or Cat Day.
They just had that at Yavapai, you mean?
Did they really?
They had a
Who, by the way, is
piece of
being run by now, Ed Boakes is now the guy. Ed Boakes just came from, he left, for whatever reason, left Los Angeles, and now he came from, I think he went from Phoenix to Los Angeles, back to Yavapai. I think that's how it worked.
New York.
I didn't know, went from New York to Los Angeles first. New York to Phoenix.
He went from Phoenix to New York and
Okay.
Los Angeles.
But anyway, I know he's at Yavapai, he just shot me an email. By the way, we've shook hands once, we've never met, but he did send me an email letting me know that he's here now. All right, so getting back to Barkley, my
Yes.
buddy Barkley. So Barkley's been doing this for a lot of years, and you think that this really helps in terms of keeping Barkley
He loves it.
stimulated? He
He
just
likes,
enjoys the heck out of it.
loves to have things to do, needs things to do. And he knows when it's Monday. He loves the attention. He gets a great deal of attention here.
Is he tuckered out when he gets home?
Now that he's older and kind of weak in the back legs, I don't stay for more than an hour and a half.
Okay, so it's
I
short.
cut it off.
That's perfect.
I cut it off. And if we have an unusual day, a stressful day, a lot of children at once, not very often, that doesn't happen often, but if he talks to somebody or someone comes and leans on him and things are stressful for him, we don't stay that long. And he looks up at me and rolls his eyes.
So
And-
would you say that the therapy is just as beneficial for Barkley as it is for the people that he's serving?
Oh, he loves it.
Yeah, he just
He loves it.
good. Barkley, I hope you have another 11 years of doing
I'm not so sure about that.
it. Sometimes they surprise me.
Could I tell you
Now
something
you can tell me
quickly?
whatever you want.
Monday morning, we were in the progressive care unit, which is a step up from the ICU. And I asked the nurses at the desk if there was anyone that we shouldn't see or anyone it was okay to go into the room to see. And they said, you can go in anywhere, be careful in this room, just be aware that the man has had a stroke, he can't speak, he can only move his right hand. I'm getting all choked up.
That's,
And I just spoke with the family, excuse me.
no, that's,
The family was sitting outside the door, and I asked if it was okay if I went in. And they said, yes, he just absolutely loves dogs. So I went in, and I explained who I was. I said that this was Barkley, and I was just in there a couple of minutes. And I said, I won't stay any longer. I just wanted to say hello. I'll be darned if that guy didn't say hello. And they hadn't been able to get him to say anything.
you know,
And then I was like this. So-
I know, I can imagine what you're feeling.
Oh, I get very teary here.
No, but see, the thing is that you bypass the tears, and it's worth the tears because you know that you're helping somebody else. I think that's what.
Oh, and everybody that I come and see helps me too.
And I would never negate the fact that someone who, any medical people here? Yeah, there was some medical people. But anyone that, I've seen it happen so many times. I saw it happen in my own family when my grandmother had a stroke. That they can tell you that medically this person, but yet you bring an animal around them and there's some type of reaction.
He did come around. I watched him come back and look, and when I said hello, I swear he said hello
I'm
back.
writing a new article. There's a brand new study that was done in Europe on the way dogs react when we leave them. And when we're with them, their heartbeat and our heartbeat are in sync. When we leave them and the dog is suffering with separation anxiety or abandonment issues, their heartbeat, now you're making me teary-eyed, their heartbeat actually changes. So there's a whole new study that was really done at a major university that suggests that our dogs and our cats, heartbeat-wise, are in sync with ours, which I just find absolutely, that's why I say, and now we're just finding out that dogs are sniffing at every type of cancer.
Yes.
And you know, I never thought that it couldn't be done. Being that my specialty was sniffing out bombs and drugs, I'm very well versed in the olfactory of a dog and the way they differentiate odors. For example, you cook spaghetti sauce, that's what I smell. The dog smells the oregano, the garlic, and whatever else goes in there, okay? So it's a whole different ballgame. Anyway, you continue what you're doing, and you continue what you're doing. You guys
I
do
love
such
it.
a great
I love
job.
it.
Yeah.
And it's extremely satisfying.
I see the CD, the AKC CD on his vest.
And he has an ASCA, an Australian Shepherd Club
There
CD.
you go. CD, by the way, for those people who don't know what CD is, in the American Kennel Club, you can earn different types of degree. There's sub-novice, there's novice. CD stands for companion dog. And basically, it's heel, sit, stay down, come. Wait, don't go. Heel, sit, stay down, come. Stand for examination. That's what CD. CDX a little bit more advanced, you know, drop one recall, 5 minute, I think, out of sight, stay. It's been a long time since I did that. Let's go. Tony Tennille, how are you?
I'm just great. You want me to put Smokey on the chair?
You
or
can put
is he-
Smokey wherever you want to put. Wherever you want to put Smokey.
Yeah,
You want me to chair for Smokey?
Here, let's put him up so people can see how
Here,
cute he is.
Smokey.
Here we go. Smokey, chair.
When's the last time you guys got a chair for your dog?
Here we go. Here he is. Here he is.
Denise.
Okay. Good boy.
What's it?
Yeah, well, I'm fine like this, if that's okay.
I'm fine. Well, good, then I'll sit.
You sit.
So, Tony, tell me about, first of all, what a beautiful Australian Shepherd.
Yes, he's a
What-
beautiful boy.
How long have you been around Australian Shepherds?
I got my first Australian Shepherd about 15 years ago.
Okay, so what do you think about the miniature Australian Shepherd?
Oh, you don't want to ask me that.
I'm asking only because someone just called me up with a miniature Chihuahua, and I'm saying to myself, how tiny could a miniature Chihuahua be? So when I tell people, call me, I have a miniature Australian Shepherd, I have a miniature Collie, it's a Sheltie ma'am, I have a miniature this, but all of a sudden I'm getting a lot of calls from people that assume they have a miniature.
Well, I think it's Kathy
They're
knows.
officially the miniature American Shepherd now, recognized by the AKC.
So they changed their name
They are
over.
their own breed.
Okay,
They are
great.
not recognized by the Australian Shepherd Club of America.
Yeah.
Okay, so it's in a whole different ballgame.
A whole different breed.
It's kind of like what they want to do with the white German Shepherd, because the German Shepherd Club wouldn't accept them, so they started calling them American Shepherds. And now there's the Shiloh Shepherds.
Oh,
Heard
wow.
that one, Gary, the Shiloh
Yes.
Shepherds?
Yes.
Interesting. So anyway, this is a real Australian Shepherd,
Yes.
not mini, not oversized,
No.
a normal, everyday Australian
He's a
Shepherd.
normal
Well, not
everyday.
everyday, but.
Well, he's a boy, so he's a little bit bigger than the girls.
Now, how did coming from the entertainment field, how did you wind up getting involved with pet therapy, and what was the trigger that said, this is something I gotta do?
Okay, well, all the years that Daryl and I were on the road as captain in Tennille, I always wanted to work in a hospital. My sister's a nurse, and I've always felt that there's something I could do. I didn't know what it was, but I was on the road all the time, so I didn't have time to do it. So when Daryl and I moved here to Prescott, I met Kathy
You
Bryan.
said it right, too.
Oh, well, yeah. I met all these ladies that are here, and Kathy Bryan had, actually when I met Smokey, he'd just been born at Kathy's, he was 2 weeks old. Didn't know he was going to be my boy, but he was my, thank you, sweetie. And so Kathy told me about the program, and Smokey became my boy. And I worked with him and raised him until he was ready to test it at 1.5 years. There's 2 levels of passing the test. There's 2 different levels. One is called predictable. That means that the dog is allowed to go in the hospital into predictable situations, maybe a waiting room, something like that.
Not into ICU.
Yeah, not into ICU. And then there's the one that's called complex. And Smokey at 1.5 years passed complex. So we go into ICU, we can go to IV therapy, we can go all over the hospital together.
And what are you finding in terms, you come from an entertainment background, and how do you feel now? I'm trying to come up with the right question.
Okay.
When you go into a room and you see someone who's obviously ill and recuperating, hopefully, and do you get the same enjoyment out of that you did when you were entertaining?
Oh yeah, oh absolutely, and it's a feeling of I've always wanted to. I have this thing inside of me of making people feel good. I mean, I have a kind of a happy thing. I don't know, but people seem to enjoy being around me, and he is the perfect dog for me because he expresses that as well when we go into a room, and when we go in. It's very interesting. People say, well, don't people recognize you? Well, first of all, I'm like 40 years older than I was when they remember me. And my hair is different, and I'm old. But anyway, the main thing is, when we go into a room, I'd say 1 out of 8 people even look at me. They're always looking at the dog. And one of the things I like to try to do is to get people to talk about their own.
Has nothing to do with age. I can see the most beautiful 22-year-old walking down the street, and I'm looking at the dog.
That's right.
Again, that's just me.
No, that's everybody. 1 out of about 8 people. And now it's a little bit more because people know we work here. It's kind of gotten around. There have been a couple of stories. So our days are Thursdays. So people kind of know it. But I've been through, in the 2.5 years that we've worked here, I've been through some interesting experiences. He loves it. He loves knowing he's coming because he gets loved and hugged and petted all the time. That's great. But I remember one particularly stressful day when I was most proud of him. I'd had a request to go up to ICU to see a friend of a friend whose father was in there. And he was on his way out. And as we got off the elevator and came down the hallway, I heard this screaming and hollering and just horrible sounds right in ICU. And there was another patient in there. It was a woman who was dying, like late stages of cancer, and obviously they had not, handled her medications very well. Her family saw me coming in with the dog, and they said, "Please, please, please come see Mother. She's, she loves dogs, and maybe you can help her calm down." Well, the woman was in terrible pain, but I said, "Well, I'm supposed to go to this room first. Let me come back after I've seen this patient, and then we'll see your mother." And we did go in right away before we went to see the other patient, but the woman was not even, she didn't even recognize anybody who was in the room. She was in such pain. So I took him down to see the other patient, and he was wonderful. And he got right up on the bedside chair and was petted and loved, and the man was loved Australian Shepherds, and was obvious that he knew Smokey was there. So then we went back to the other room, and by that time the doctor, who I know, who's a wonderful person, had given her some morphine, so she calmed down a little bit. And I put him up on the chair, and he sat patiently and quietly as the woman, just gently touched him. I don't even know if she really realized he was there. But he behaved in an exemplary manner, even when she was screaming and thrashing. I'm the one who went home after that, and I had to talk to some of my friends about that, because they both passed away the next day. So that was hard.
They know, Tony. They
do.
I lost my first wife at a very young age. She was 36 years old. She died from melanoma. And at that point in my life, I had a small group of animals. I had 30 cats, 20 dogs, 6 chickens, 6 ducks, 2 1,200-pound pigs, a couple of snakes, all rescued animals. I had to buy a farm in upstate New York. Speak about Westchester, upstate New York, at a place called Cobleskill.
Yes, I know that is.
I used to teach at Cobleskill. They have the university up there. I used to teach behavior. And I had a small farm that was built in 1802. It had an outhouse, okay? But I needed a place in a weekend to get all my animals up there. And when Faye passed away at a very young age, and all the animals grieved, and when I started talking about the fact that I wasn't able to grieve at that point because the animals were grieving, they actually delayed my grieving until I was ready to go through what I had to go through. And somehow, when I talk about that to people, and when you talk about your dog's reaction to people, they don't understand the concept. And I recently interviewed some pet psychics, and I got to tell you, I'm not the biggest fan of pet psychics because, first of all, who's going to argue with them? A quick pet psychic story. I'm doing the Today Show. Pet psychic's in the green room with me.
Yeah.
Person brings a dog in that she's going to analyze, and the psychic says to the owner, "Well, give me a little background on the dog." The owner says, "Well, I picked him up as a stray. He was 30 pounds underweight." We go on the show, and the lady looks at the dog and says, "I know you had a rough start in life." No kidding, you had a rough start in life. 30 pounds underweight as a stray. But anyway, when I started talking about the whole concept of animals having emotions, that's when I was really kind of branded this eccentric, crazy type of animal guy. But there's no doubt in my mind that they know that they have a sixth sense. I believe that every living thing has a sixth sense. I really believe that. Not just since I moved to Sedona either. But the concept is, I think it's inhibited in everybody. I think that not everybody, but a lot of people are inhibited. I don't think it's inhibited in dogs. That's why one thing I learned, and I think I've spoken to Gary about that, I've been in circumstances, and I can't go into details. There was a couple of weeks in Libya or a couple of weeks here where my life was on the line, and I got to be honest with you guys, I never trusted my own instincts. I always trusted the dog's instincts because the dog wasn't overthinking. Well, could it, should it? They were acting on what they knew. And I always tell people, even trainers, to react to your dog's instincts. They always know what happened. So I guess the big question for you then, Tony, is who do you think gets more out of it, the dog or you, or do you think it's pretty equal?
I think it's equal. I get a lot out of it. It's so, especially when I get feedback from somebody I may meet when I'm down on the square in Prescott and with Smokey, and they'll say, "You came to see my father when he was in the hospital. Oh, and it meant so much to him," and that kind of thing, which really means a lot to me. And Smokey, I will tell you, after we've worked, an hour and a half or so, and I watch him very carefully because he will tell me when it's time to go. But when we get back in the car, and he goes in his kennel, he goes to sleep.
He's had it.
He goes to sleep.
It's kind of like me after the radio show.
Yeah,
That's it. I'm on, I'm off. I'm on, I'm off. Now, do you ever find yourself, or do you find the dog, let's say you've come here several weeks, and let's say it's someone who is in the hospital, and it's someone you're visiting, but it's also someone that everyone knows is not coming out of the hospital. Do you find that really challenging from your perspective as the handler, but also the dog's perspective?
You know, I don't think so, because I mean, my sister Jane, the one who's the hospice nurse, I like to think I have some of what she has in me. I'm able to walk into a room even though I know somebody's not going to make it, and you know, it's the here and the now. It's what's happening right now, and here's the dog. You're in ICU, you're scared, you've got tubes in every orifice practically, and things are beeping, but a dog comes in, it must be okay if a dog is here.
It's time to fetch a ball.
Yeah.
That's where your mind goes.
Yeah.
Tony, you keep doing the great work you're doing.
I'm
You too, Rosie.
Smoking.
That's smoking.
That's smoking. That's
Two
all
of them are strong.
Come to our
And
house.
one boxer.
right. Wait, there's another one.
I'm
This,
waiting
Come
on next.
to our houses.
this is
Yeah, I can
Smokey's
imagine.
older brother, right?
I don't know too many people that have an Australian Shepherd that have just one.
No, you
Oh,
don't.
no, I have 3.
They're like potato chips.
Yeah. Well, we've got his 2 little nieces that are 11 months old soon, the 30th of this month, Bebop and Lula.
Bebop
And one of them, they're both blue merles.
I just really, Bebop I just got it. Takes me a while, but I just got it.
Daryl named them.
My husband named them Bebop and Lula. And one of them is going to be my new therapy dog. I'm studying them right now to see which one I think is going to be the easiest to train.
easiest to
I
train.
think it's going to be Lula, but
Just
we'll
remember,
see.
it's always the dog that looks up and says, "Are you talking to me?" It's always the one that works out the best. All right, so we're going to move on.
Okay.
Thank you, Smokey.
Thank you, and I'm going to go over here, and Kathy's the mama of this whole thing.
All right, let's talk to Mama. You want to sit down?
I'll stand behind Brick.
Okay, then I'll sit.
He's the star. You sit.
Hi, yeah, what's
This is Brick House.
Brick House? Hi, Brick. I know you're not supposed to live here. I know, God. You can nudge if you want.
You will.
I'm gonna go home after this.
Denise.
I have a rescued Chihuahua terrorist mix. And I have a German Shepherd that I took off the streets of South Central LA, covered in blue paint. Yeah, it was, you know, these stray dogs in the gang neighborhoods now, they paint the stray dogs the color of the gang. So my dog was equipped. And him and the Chihuahua are just like, God, I can't imagine what it's like going home and not having a pet. You know, luckily I've never been in that situation. Even when I was in the service, I was lucky enough to always have dogs around me, you know, so it's good. Hi.
This is definitely approved therapy.
I was just gonna say, Gary, can you find me an affectionate dog?
Welcome to my world.
Yeah.
He's been doing therapy work since he was 15 months old.
I just love this position he's in. Butt up, front down. This is perfect play position right here. What can we do? Your name again, first.
I'm Kathy Bryan.
Let's get your face. We got our face above the butt? I just want to make sure. I just want to make, so I understand that you're like, I don't know what the right word, the mentor here. So tell me how you got started in dogs, first of all, and in therapy, second of all.
In dogs, I've had Australian Shepherds for years. I am a breeder. I compete in versatility with them. We do stock work, we do agility, we do obedience, we do the conformation ring. I breed very little.
Geese or
I have worked
sheep?
geese. You work ducks, geese. In the olden days, I used to work pigs. I don't do that anymore, but primarily ducks, sheep, and cattle. And we've worked, all of us, we brought them into the neighborhood, and we do that.
It's amazing to watch them work.
It's amazing what these dogs get us into, the stuff that we buy for our dogs. But the therapy dog work, I lost my daughter 10 years ago to a drunk driver. And her dog was a year old at the time. And this program started, and it became a therapy for me. And her dog was their Smokey and Brick's father.
Brick's daddy.
His name was Moon. He was a very famous Australian Shepherd. And it kept me sane. The work kept me sane. And it was therapy for me. And of course, the patients benefited.
So then you realize if it's beneficial for you, it can be beneficial for patients.
Absolutely, absolutely. And
So you've been doing it for a long time now.
I've been doing this for a long time.
What do you, gotta give Johnny there for it's my body in the dog's face.
They only made the cut at Eukanuba, you know.
That's,
He's a
no,
press
he's fine with me. The less of me, the more of him. So you've been doing this for a while, and I'm gonna ask you the same question I'm asking everyone. Obviously, you have a lot of background in training, a lot of experience, and I can see the way your dog behaves, that your approach to training has to be very similar to mine in terms of
Everything's
very,
positive.
very positive. In other words,
Everything's
if
positive.
your dog doesn't want to catch a ball, fine, a frisbee's okay with me, you know? That's what I'm impressed about. That's what I'm impressed about with every dog I've seen here so far, is that it looks like, it's not like, oh man, 9 to 5, I gotta go to work today. It's like, I can't wait to get there. And again, when you leave Tuck It Out, or he ready, how old is
Brick is 5.
Brick is 5, so he's pretty
He's
much
still
a baby,
young.
yeah.
No, you know,
Going through his midlife crisis.
I've been in here with his dad. We'd come in and we'd go out and work cattle in the morning, and then we'd wash up and blow him dry and get him nice and clean and come in and visit patients. And then that evening he'd go out and work sheep. You know, high strung, no,
But that's what an Australian Shepherd's supposed to do. It's like,
but they rest when they need to.
exactly. It's like people, they'll call me all the time, it just absolutely drives me crazy. When people come to the door, Warren, my dog barks. What do you want to do, answer the door and have him sign something? That's what a dog does, a dog barks. And then so he barks for 5 or 10 minutes. Well, that's what a dog's supposed to do. If you don't want your dog to bark, maybe a Basenji is the right choice for you. And then, but my dog yodels when people come to the door. He doesn't bark, he just yodels. I am so impressed with what I've seen here at the Apple Pie Regional Medical Center. First of all, I'm so impressed with what you've done, and I know, let me tell you, having been, I don't want to say a pioneer, but one of the originators of this, when I first started going to nursing homes and hospitals and hospices in New York, in Connecticut, New Jersey, I mean, I was kicked out as fast as like, what do you mean you want to bring a dog in here? What are you, crazy? You can't bring a dog in here. It's a medical facility. And I said, but yeah, don't you read the studies? They're beneficial to exactly the people in this hospital. No, they're dirty. Let me tell you something. The people that are coming in to visit, those are the ones you need to be concerned about, not the dogs that are coming in on a regular basis. So I'm such a strong believer, first of all, in what all of you guys are involved with. I think it's probably, you know, my radio show now, it's heard in 200 cities and Canada. The show you hear in Prescott is the national show and a Canadian show, but then I do a separate show strictly on KROA in Los Angeles. And it's amazing to me how many people want to get involved and want to do something like this. They just don't know where to start. They just don't know how to get started. There are groups, you know, Pasadena Humane Society, and some of the humane societies get involved. And I always tell people also, and what amazes me, is some of the dogs that come out of the shelters that were destined to be euthanized, that turn into be some of these amazing therapy dogs. And for those people that are thinking about dogs, you know, a lot of people say, Warren, well, you know, I really like Australian Shepherds, but are there any Australian Shepherds for adoption maybe? And I always tell people, you know, always check out rescue. You never know when there's a, I do a lot of work with Boxer Rescue in LA and German Shepherd Rescue. 25% of all dogs at shelters in the United States are purebred dogs. 25%. And so if you have a need for a purebred dog, me personally, I have a German Shepherd, a rescue, but it's only because that's what I grew up with. But I always tell people, when you go to a shelter, and I was at Sedona Humane Society not too long ago, when you go to a shelter, people look at the dog and say, oh man, what a beautiful dog you are. and that's what they adopt. And I tell people, you know what, after you have a dog for a day or two, you forget what they look like. You fall in love with the inside. You don't fall in love with the outside. And I always tell people that there are so many great dogs out there. You're into a specific breed, and I love that you're a professional breeder. I'm very anti-puppy mill. Way too many Australian Shepherds coming out of puppy mill.
I do rescue.
Great breed of dog. But I always tell people some of the greatest therapy dogs. Gary, I'm sure you've seen this as well. Gary DiGeronimo, by the way, just a great guy, behaviorist and trainer. I've known for a long time now. I'm not going to say much about him because his head is way too swollen already. But he's just one of those, you know, I work with a lot of people in my career, and Gary's just one of those guys that walks the walk. And you know, I work with behaviorists and trainers at almost every shelter, and some of them I wouldn't let change the oil in my car, okay? But, you know, there are questions that I even have where I might ask Gary some questions, and I'm a little older than Gary. I've been doing this a little while, but you're so lucky to have him here. And to put this all in perspective, everyone here right now is kind of smiling. If you look around the room, everyone's kind of got that smile on their face, and everyone's so into what they're doing. So here's what I want to say to you guys watching this whole thing on the website. if you're considering pet therapy, go about it the right way. Get involved with a group of people that is already working. Get involved with an organization that already has hospitals or hospices or nursing homes or whatever type of scenario, even prisons we talked about. Get involved, educate yourself first, know what's involved with it. And I gotta tell you, there's not a whole lot more rewarding things in life than going into a room where someone's sick physically, or in many cases, like some of the cases I worked on with autism and chronic schizophrenia. When you see that change in the person, and you see that person that never smiled all of a sudden smile, or the person that said hello to your dog that was not talking to people, that's what it's all about. And if you're expecting miracles, working with these dogs, these therapy dogs, you can expect them because they do happen every single day.